Dr. Palin was recommended to me by a friend, and I was interested in speaking to him because for me it's really important that I was getting treatment by somebody that is an expert in their field. I wanted somebody who really understands facial anatomy, and Dr. Palin is a neurosurgeon, so that for me boded well. And when I came to see him, he was very good at explaining the procedure in layman's terms, and I really liked that. He also explained and was very candid about any side effects. I just found that he really reassured me about the treatment I was going to be having, and he's got some fabulous testimonials from other people which really gave me that extra confidence that I needed to reassure me, because this is the first time I'm having treatment, and I needed to know that it was going to A, be safe, and B, it was going to work really effectively. Right, well, I feel I'm getting older now. The lines are showing.
Okay.
And so I can see a line there and a line there, and I feel that my eyes may be drooping slightly. I would like to have a bit more of a cheekbone look, and just basically to remove some of the lines that you can now start to see on my face.
Okay.
Given I'm in my early 50s now, it's something that I'm more conscious of, and I would like it correcting if
Fantastic,
possible.
fantastic. So you mentioned these lines here.
Yeah.
So the nasolabial lines, which often are there from an earlier age. So what we need to do is kind of restore the cheek so that actually it lifts and softens the nasolabial lines. Now, looking at your face, you've got a lovely feminine heart-shaped face. So the natural beauty point on a woman is around 1 centimetre out from the corner of the eye and 1 centimetre down. And because that's further out, it kind of enhances that heart-shaped face. A man is slightly different. That's more straight down and 1 centimetre down, and that's because a man's face is more angular and more square, not a heart-shaped. So I want to make sure I preserve the heart-shaped face and enhance that as well. So we're going to start by injecting at your beauty point here and extending the filler backwards, which should hopefully restore the natural cheek and soften these nasolabial lines here.
I like the sound of that. That sounds really promising.
So you mentioned also that you're quite interested in having some lip filler done as well.
That's right, because my lips are very thin, and
Yes.
I think I would benefit, but I just want that natural look. I don't want it to be too excessive.
Okay, so again, with the natural aging process, as we get older, the lips loses volume, and as a result they do appear smaller. Now you have, I think, naturally smaller lips anyway, so what I would like to do is just to insert a small volume, maybe 0.5 ml, to kind of restore the kind of youthful appearance that you had and just enhance that slightly as well. How does that sound?
I really like the sound of that. I think it will look natural, so I'm really happy to go with that treatment.
Fantastic. One thing which you do have, which I would like to comment on, is you have a really nice vermilion border, which is actually the border between your skin and where your cheek is, so that colour differentiation. So that border is quite distinct. So I think we could really enhance that as well.
Right, that sounds really promising.
Okay, so the other thing I would like to ask is about your Cupid's bow. Is that something you would like enhancing?
I think I would, yes, because I think it will give more definition. So I'd like to try that today, please.
Okay, fantastic. That's something we can try and achieve for you today.
Thank you, yeah. Also, I've got lots of lines now forming on my forehead.
Okay.
And those 2 lines there, which I really don't like, and I would really welcome your advice on how and what you do to remove them.
Okay, fine. So generally speaking, these lines around the forehead, the crow's feet around the eyes, and the frown lines, we generally treat using Botox. So there's a couple of fine crow's feet lines there which we can target. And if you lift your eyebrows up, okay, that's great. So you have quite a few horizontal lines. Now these horizontal lines are caused by the frontalis muscle, As it contracts, it causes some creases in the skin. So what we'll do is we'll target that muscle to relax the muscle, and that will stop you getting these horizontal lines. And although it won't take away the static lines that you have, it will soften over time because you won't have that constant contraction of the muscle. Could you finally give me a frown, please? Okay, so you have these lines here as well. So we will need to treat them as well, even though they're not as deep and not as obvious. If we treat the forehead lines and leave these out, what happens is, because that muscle is then paralyzed, these muscles they get stronger, and these lines become more prominent and deeper, and it can give you like an angry looking face, which we do not want. So we will need to treat these areas if we're going to treat the forehead as well. Is that okay?
Yes, it is. Thank you.
Okay, fantastic. Great. So do you have any questions at all?
No questions. No, you've gone through everything really thoroughly.
Okay.
Explained the procedure, which I really appreciate, and you've explained the risks. So no questions. Thank you. I'm happy to go ahead.
Fantastic. So let's get you started. And as I say, if you need me to stop at any point or you want to pause, let me know, and we'll give you a few minutes break and then we can continue. Is that okay?
Sounds good.
Do you think they are okay, or?
Yeah.
Are you wanting them bigger?
I wouldn't want them any bigger, because I think that... What do you think?
And they're going to be swollen, so they're going to die down a bit. They look very symmetrical, which is the key.
I think it looks natural. I can tell there's obviously just a little bit swelling.
There is some swelling, yes.
So it'll settle, but I'm very happy with that because I think it does look natural.
Yeah, I think
anything more would look too much for my face.
I think considering you didn't have any lips, I think this is right, and I don't want it to look like you've had work done as well. I just want it to look natural and so you've got naturally plump lips.
Absolutely, it's just enhancing them. And
it's enhancing your own features, and that's all I'm doing.
Yeah, God, I feel like I've got lips.
Can you?
Yeah, I can tell. Yeah, definitely. They're more fuller.
I don't think you should have more than that. I think that looks good.
Yeah.
Okay, so now we're going to look at your cheeks. So your natural beauty point is 1 centimetre out, which is here, and then 1 centimetre down, so around here. And if we balance the pencil on here, it's roughly where it is. I think naturally yours is a slightly bit lower there, is your beauty point if we were to pivot this. But I think if we aim for between there and there, then it should be okay. And then we can extend it going further back. So on the ridge there. And what that will do is that will pull that up slightly, soften that, but also restore where your cheekbone should be. So you have more of a cheekbone and restore the natural heart-shaped face, which is more feminine, which is what we're trying to preserve here.
I like the sound of that.
Right. So again, 1 centimetre out and 1 centimetre down should be around here, which is your beauty point. Again, let's pivot. Actually, on this side, I think you're actually closer to what the beauty point area should be. So I'm just wondering, if we just look at your face, I think it roughly is the same. Sometimes no one's face is completely symmetrical, and what I can try and do is try and make it more symmetrical. The more symmetrical a face is, the more it appears to be beautiful. So if I can try and enhance the element of how symmetrical it is, that will certainly make you appear more beautiful. You've got a slight... Have you noticed these creases there?
Slightly, I can see.
Yeah. So you've got two separate fat pads. You've got one here and one here, and it's kind of separated by this ligament here called the zygomatic ligament. And often, as you get older, these fat pads get bigger, and what happens is it kind of droops down the face. It causes the nasolabial lines, which are these here, and these lines can get a bit more prominent here. What I'm hoping is by injecting filler, starting at the beauty point and going back, we can kind of soften the nasolabial lines and soften these lines. Occasionally, there's still a bit of a line here afterwards. What I would like to do is, once all the swelling settles down, which should be very minimal, but once we know exactly the end result, perhaps in about 10 days, 2 weeks, if there is still a bit of a groove here, we can treat this by putting some filler just directly underneath the ligament to actually smoothen that out as well. But I think first of all, let's start with your cheeks, and we can always work down if needs be.
That sounds like a really good idea and a good plan.
Fantastic. We can also aim, because you've got I think your periorbital region, your tear trough area, I think there is a bit of a dip and your skin is quite smooth, and I think we would be able to do some filler in the tear troughs without too much puffiness. We do worry that sometimes by injecting too much filler around here you can get puffiness, but I think we can still treat that area.
Yeah, I like the sound of that.
Okay, fine. So let's get on with your treatment on your cheeks and we'll take it from there.
Thank you.
Sharp scratch. Are you okay?
Yeah.
Just withdrawing now to check I'm not in a vessel. That's an important safety check that we do to ensure that we don't cause any complications. A scratch now. Doing really well, and again just going to How are you feeling now?
I'm okay.
Good. Bit of bleeding there, which is completely normal. I'm just going to put a pressure to minimise any bruising, okay? Just to clarify, I don't think we'll get a bruise from that bleeding.
No?
No. I'm going to go to the other side now. Okay, and sharp scratch again now. Doing the safety check again, making sure I'm not in a blood vessel. And I'm just going to now slowly inject. And there's no bleeding on that side at all. Fantastic. Just going to go further back now, another sharp scratch here. Again, doing another safety check.
Can I next put lipstick on and makeup?
I would say ideally leave it tonight and you can put them on from tomorrow.
Oh, as soon as that?
Yeah. Sorry, close your eye. It might feel a bit sore, but you shouldn't get any bruising.
Yeah, no, I'm happy with that. It feels
Natural.
It feels natural. Days, once everything does settle down. That's the optimum time.
Yes, it is. Yeah. Yes, 10 days is the optimum time, so got a bit of pen mark there which we can rub off, but other than that, absolutely fine.
Fabulous. Thank you, Dr. Palin.
You're very welcome. I hope you like the results.
I'm looking forward to seeing them.